Hey, everybody. Welcome back to Beta Change's virtual roundtable. This is our second roundtable of many more to come, and we're incredibly excited this week to be talking about an incredibly important topic, which is access to medication, more specifically, insulin. My name is Robert Brooks. I'm calling in here from Chicago, part of the United States, and we're going to be bringing the team together to talk with Elizabeth Rowley, an expert in access to medication and insulin at a global scale. And the reason we're talking about this is because it's a vital topic for our survival as humans, but more specifically for people with type 1 diabetes who cannot produce insulin, or for people with type 2 diabetes, to put simply, cannot produce enough of it or cannot effectively use it or make it a part of their overall bodily functions and metabolism. This topic is paramount. And the goals of the roundtable are to hear and interact with all of you, which we've been doing all week. Thank you so much for everybody who's been talking with us on social media at Beta Change and who's allowed us to amplify your stories and your voices through our channel. We also really want to discuss these topics in depth, so if you have any questions, jump in. And really the goal here is to educate so we can push the situation forward at hand. So we brought a world-class team together, as I mentioned. We have Katie Doyle, who's the producer of this, working behind the scenes to make this work well and make sure everybody can hear and see and interact with us real time, which is where we are today in 2017. So I'll pass it over to Pei Ann for a quick introduction now.
Hello, this is Pei Ann from Singapore. Great that you could see everybody joining us on our roundtable today.
Hi everyone, my name is Ashley. I'm from Melbourne, Australia. It's quite late here where we are, so I'm really excited to be joining you guys to chat about access to insulin and access to medication today. It's been great, and I look forward to a great conversation. And I'll let Elizabeth introduce herself as well.
Hi everyone, my name is Elizabeth Rowley and I'm here in the UK tuning in. I'm the founder and director of T1 International. We are a global advocacy organization for people with type 1 diabetes, and we work with communities around the world to push for access to insulin, diabetes supplies, care, and education for all people living with diabetes. I'm really excited to be here and talk about access to all of you. So started. Thanks.
So let's get started. We have about 30 minutes, maybe 40 minutes here for all of you to jump in and join us live. But let's start it with the big question, Elizabeth, and this is going to you, and it's 2017. Where are we today in regarding access to medication for diabetes, and more specifically, insulin?
So yeah, that's a big question. From a personal perspective, I would say we are not where we should be. As you said, it's 2017. We're almost 100 years after insulin was discovered and first used in a human being to treat type 1 diabetes, and yet there are hundreds of thousands, maybe even millions of people around the world who cannot get the insulin that they need to survive. So looking at that today, when you sort of see how far advances in technologies have come with insulin pumps and CGMs, and even artificial pancreas is coming out, it can be hard to see that when you're also looking at the fact that people are still dying or suffering excruciating complications because they can't get something as basic as a vial of insulin and a syringe. So I think there's a long way to go, and T1 International did a survey last year that looked at the out-of-pocket costs that people are paying for their insulin and supplies and other vital things that you need. I think it's a good way to illustrate people are paying anything from 0% of their income to 118% of their monthly income on their diabetes supplies. So some people must pay more than they earn each month of their diabetes, which is mind-blowing if you think about that. So in terms of just simple by itself, it's definitely a huge issue, and I'm glad we're going to be talking about it more.
And Ashley, did you have an additional thought on that?
Yeah, that's a great introduction. And I think I would like to hear your thoughts, Elizabeth, on, do you think it's because the hurdles we face today is due to insulin being something that's pharma dominated, in terms of they're the only ones producing insulin, and, where are we at in terms of, seeing generic insulins and things like that? I would love to hear your thoughts on that.
First I was sort of talking about where we are and now the why. Why is it so difficult for people to access or afford? And so, yeah, I think you touched on a few very important points. Price, as I said, and cost is a huge thing. So if you simply can't afford something, you're pretty much out of luck unless you're lucky enough to get donations or something like that, which is a whole other topic to discuss. But it is very much the insulin distribution is dominated. 90% of insulins are from the big three insulin makers, which is Eli Lilly, Novo Nordisk, and Sanofi. And it's really, really tough for other players to get into that market because it's really dominated by these three players. So when we're talking about generic medication as well, when it comes to insulin, it's a bit different. It's not technically called a generic, it's called a biosimilar. And biosimilars have a lot of their own challenges because you're kind of having to look at the drug molecule and makeup. So when you're creating a biosimilar, we like to say it's like you're trying to bake the same cake, but you have to find a different recipe for that cake, and you're kind of out on your own trying to do that. So it puts off a lot of companies from really wanting to do that because they have to go through the same testing, the same trials, the same regulation processes, FDA approvals, all of that a brand new drug would, which is very, very expensive, as opposed to when you are creating a generic, it's more just like a copy. So that whole scene is very complex, and that's another reason why I think we're seeing very high prices with insulin. But that is definitely one piece. I mean, we need transparency from pharmaceutical companies to be able to understand why this pricing is the way it is. Why are people in one country paying, for example, $5 for a vial of insulin, and people in another place are paying $100? So pushing for pharmaceutical transparency is huge, but then there are a lot of other things to look at in terms of why access is a problem. Maybe there's not enough government spending, maybe the supply chain isn't a strong one, so actually getting the insulin to a rural clinic is a huge challenge, or keeping insulin cold, or some people are living in crisis situations where they're getting insulin is on a long-term sustainable basis is a huge challenge. So yeah, I mean, I think, like you said, Ash, pharma dominance is a huge thing, and that can make a huge difference in this issue. But there are a lot of other complex issues to look at as well.
As a follow-up question to that, so you were talking about the three big producers and really the production of insulin, which seems to be a global issue that trickles down to both a regional and local level. If you could say, in maybe one or two of these challenges or hurdles or whatnot, what would you define as the two largest at a global level that trickle all the way down to the local level?
I would probably have to say, the people who make and sell the insulin have a lot of power. Oftentimes companies want to blame the middlemen, the insurance companies, and they do have a part to play in this. But when these companies are making billions and billions of dollars in profit, they have the power and control to actually make real change, make things affordable. I know they're in it for a business, so we always have to consider that and remember that. But at the same time, I do think that is probably the number one thing that could change and make things better for people, is if prices were made more affordable, and if these companies truly cared about humans and prioritized people over profit. So that's a big one. The number two biggest is tough. I'm not really sure, because as I said, it really depends on where you are and what your local situation is. But I do think having an understanding of the severity and the dire deathly consequences of not having your insulin in supplies is huge, and also looking at how much these complications or hospital admissions actually cost to a government. Treating it regularly and healthily along the way is really going to save money in the long run. So it's about that whole sort of package of awareness and understanding and economic cost and cost savings, cost benefit to treating people, even though it seems expensive up front, it's going to save costs down the line. So I would say, something along the lines of the awareness and sort of government support of access to medicines. And that doesn't just mean diabetes as well. There's other chronic conditions, non-preventable conditions that this should be made a priority for as well.
Really interesting thoughts there. And it was funny that you used the word economics, because for me in the United States, which has or should have plenty of resources for diabetes and for healthcare, economics doesn't really apply to healthcare and the system that we have set up, at least today. And it's always changing, which is probably another difficulty. But, it's not as simple as a supply and demand, because clearly there's demand. People need it. People are looking for both insulin and other medications for diabetes, in all medications, really. If you look into some of the pharmaceutical challenges that have been in the news lately. But it is interesting because it's also the supply chain for us here in the United States, as I'm sure with everywhere else around the world, because it's not like I can just, go and pick this up at the local store. I have to either get a prescription from my doctor, and that doctor I might not be able to get into their office for 6 months. Me specifically, I couldn't make another endo appointment for 12 months, which is scary. And so with that, there's certain barriers that are put in place, as I say, right in the middle or through that supply chain. And I'm curious, Payan or Ashley, I'd love to hear if you have any specific thoughts as it relates to this global down to regional and local level. And we'll start with Payan.
For me, coming from a patient from Singapore, I feel kind of privileged that I get easy access to insulin. So basically, it's just a simple 3-month prescription from your doctor every time you go for an appointment, which is about every 3 to 4 months session. And then you can easily get your insulin from the pharmacy at a hospital, right? And then on the other hand, why do I feel privileged is that because I hear lots of stories. My friends from the other less developed countries, they have issues accessing, getting insulin supplies. And it kind of worries me, as a person with diabetes, how do we survive without insulin? Yeah. How about you, Ashley?
What you said, Payan, has mirrored a lot of what has been shared with Beta Change over the last few weeks. We've had people talking about what insulin and what access to diabetes care means to them. And for some of them, like for Emily from New Zealand, to her, it means freedom to do what she wants, freedom to live a healthy and normal life. And for people like Nathan from Bolivia, he talks about, friends and family having to actually sacrifice a lot of things to actually just live healthy with diabetes, because access to insulin is so difficult and so expensive that they can't possibly have that luxury there. Patrick from America says something similar, that the keys, the wallet and phone and pat down before you leave the house is also accompanied with patting down to make sure you have your insulin. It's an everyday essential. So to hear stories that people are not getting those, getting things that they need to live their full life, it's really sad. And in Australia, we're lucky that we actually have the NDSS, which is the National Diabetes Service Scheme, that subsidizes a lot of our insulin, our medication supplies, equipment, and things like that. And yes, it's a huge privilege, but at the same time, we need to look outside beyond our bubble and help those who can't afford insulin and, supplies and things like that. So I think that for me is big, and this is why we're having this discussion here today. So, so that's my thought. I think I'll pass it back to Rob.
Thanks, Ashley. And again, thank you for all of our everybody that's been talking with us, and everybody that's been really so supportive in what we're doing here at Beta Change, because we want to also support you and really get the messages out. So individuals like Nathan and Patrick, and I can speak firsthand. I might not be located in Bolivia or in other places around the world, but I am located in the United States, and we are still facing some incredible challenges, one especially being the cost of medication and the cost of overall healthcare, inversely related to the ultimate, goal, and that's good outcomes and positive clinical results. So I know we have some questions coming in now from our Facebook Live page, which we will get to. Actually, a few of them are going to be on our next questions here. But please, just a reminder, feel free to jump in, ask us questions, let us know what your thoughts are on this topic now and down the road too. So, and I know that we briefly mentioned it as it relates to type 2 diabetes, which gets a little bit more complicated. As I mentioned, it's like this inability to effectively use it. There's a resistance. Sometimes you just don't produce enough of it. So I'm going to ask Elizabeth, I'm going to pass this one back to you, but, is there a lack of urgency for insulin for people with type 2 diabetes? And if so, what does that mean? What has that done? Is that delayed, or is that maybe eclipsed the need for insulin for all? And what is the overall situation there related to type 2 diabetes around the world?
Yeah, that's a good question. I think, there's always this concern and this issue with a general lack of understanding of diabetes, whether it be type 1 or type 2. I know I've talked with a lot of different people about the media perceptions, and I feel like I can't watch a television show these days without there being some sort of offensive and inaccurate joke about diabetes. And, it's not clear which type, and regardless of which type it would be, it wouldn't be appropriate. So there is this, I think, universe here from a lot of people around the world, is just this lack of understanding. And so when it comes to putting that in the context of access to insulin or diabetes, I think, in general, whether it's type 1 or type 2, there is a lack of urgency, which people don't understand, that you can die very quickly in a matter of sometimes hours or days if you're type 1 insulin. But even in people who, more and more end up having to go on insulin, or we all know that there's, different types of diabetes on the spectrum in between that you don't hear of as often as type 1 and type 2, but many of those require insulin. So I do think your point of maybe a lack of urgency is because of this lack of understanding. But when you look on a global context, 1 out of 2 people who need insulin, period, cannot access it. So that's huge. And that does include people with type 2 that need insulin, because if you're a type 2 and you need insulin, you still are going to suffer about it. So I think it's an issue, but I think the more we can all work on advocacy and awareness of diabetes in general and the negative consequences, the less that will be a problem. And it's something that we can all relate to around the world, which I think can bring us together in a unified way to tackle that particular issue. That's
a very frightening statistic, in fact, that 1 out of every 2 people around the world who need insulin cannot access it. And I know access comes in a variety of different forms. And so I'm curious, and Elizabeth, maybe I can pass it back to you for this one with access. Where does it fall into education? Where does it fall into educating perhaps governments or health entities? And then, I'd be interested in hearing from Ashley and Payan after, specific to, just the word access and really what are the challenges with that word and what that word means, because I know it takes on a variety of different shapes and sizes.
Interestingly, in the United States, people might have heard of Senator Bernie Sanders, who's been talking a lot of on high insulin prices and unaffordable prices of things. But he also has recently mentioned access a few times when, some politicians are saying, oh, well, everybody has access. And he makes the point of saying, but what does access mean? Like, I might have access to buying $1 million home, but I don't have the money to buy that home. So I think your point about sort of what access means is a really important one, because we try to also say access and affordability. So to T1 International and our work, generally access means sort of being able to physically get this thing. Maybe that's having transport to get to the pharmacy or the hospital. So it's multi-layered, and I think it's just a great point that you need to make sure like you're on the same page with if you're advocating for the government to change a policy related to access, you need to make sure you're on the same page as the government about what that means very specifically. So yeah, I'm looking forward to talking more about, you know, potential solutions to some of these issues, but I would also love to hear what access sort of means to them and what they feel it means in their country.
Pan?
So for me, I think that, you know what Elizabeth said about, you know, getting the physical, being able to get physical insulin itself, that's part of what I think access is. And I was just wondering, you know, is there a major difference between access in the less developed country and as compared to a developed country? Because I know that, you know, we know that there are many issues with regarding to access to medication in a less developed country, because they don't have, because of their situations, they may not have ample supply to insulin, or they do not have the healthcare, a very good healthcare system being set up for them to enable them to get access to insulin. So is there like a distinct difference, or what is very critical with regards to access in a less developed country as compared to a developed country, or, you know, a developing country as well?
Is that a question right for me or for the group in general? Just about go ahead.
So if Elizabeth can comment on this, and also I would also like to invite all viewers to actually comment on this as well. If there are, you know, share your experiences if you come from a less developed country, or a developing country, or a developed country, you know, to talk about what access means to you and what is the critical issue that you are facing with regards to access. Yeah, Elizabeth?
I think it very much, as you said, invite others to comment here, but from the stories that we've heard and the people we've worked with, there are different critical issues. I think that's also a really important point. You know, some people live in a country where insulin is provided to them, but they can't get test strips under the government healthcare scheme, and they also can't afford test strips, so they don't test their blood sugar, you know, except for when they go into the clinic every year or something like that, which is, I think it's difficult for some of us to think about never testing. So there are different, as you put it quite well, critical access issues for different people in different communities, and perhaps for some it's not having access to education. So maybe you can scrape by and get your insulin and enough test strips, but you haven't really been taught how to dose or how to manage your insulin, or best use of the limited number of test strips that you have. So something like that is the puzzle. At TUN International, we have a little graphic that shows, you know, all the different pieces of the diabetes puzzle, and you need all of those pieces to be able to have the opportunity to live a full and healthy life. So yeah, the short answer is there's many critical issues, and it really depends where you're from, and oftentimes it's multiple things that we're looking at that are barriers.
Really interesting comments from you, Pan, and it's a great question. And Elizabeth, adding that with your expertise, it made me think of a few things. The first of which being, you know, again, I'm speaking here from the United States, and so whether that is cost, whether that is simply having the ability in your crazy week or your busy lives to get to your doctor, to get that prescription, to get educated on that, to get educated on the dose. You know, maybe that dose doesn't work correctly, and so therefore you're nervous to use it. Or whether it's a variety of other medications or test strips. But it sounds like we each have these individual challenges. And, you know, Pan, I think that you're bringing up a great point, and that's, while these challenges may be individual and we might not fully understand why they're so complicated because we're in different parts of the world and there's like 4 or 5 different problems or challenges or hurdles. And so I think that from there it might be somewhat disempowering in itself, where, you know, maybe we should be more vocal about that at an individual level and really come together as a collective to find out, hey, you have the same challenge as I do, and that's simply affording insulin. And I'm here in the United States and you're in England or Australia or Singapore. Well, let's now talk about that at your local level, and now think of it at a regional level. And then if there really are those similarities at a global level, then we ought to be in this mission together to ultimately make the world better by removing that hurdle or that obstacle. And so that's what I've seen. I've seen a lot of challenges here. Just simply, they're so individualized. I think it's just Rob Brooks's problem, but the more and more we talk about this, it seems like, almost every person that I'm sure goes to the doctor or my endocrinologist are probably battling with these same challenges. Ashley, do you have any thoughts or comments there?
Thanks, guys. I think my thoughts are quite similar around, what Elizabeth has said around it sort of comes in a whole package. You can't just have access to unlimited insulin without a syringe or, a way to get the insulin actually in you. And at that same point, you also need the education to sort of know how to use that insulin appropriately as well. So, it's the whole saying of the equipment is as good as the person who's using it. So this applies to any sort of diabetes-related technology, whether it be insulin pumps or blood glucose meters. These things all come hand in hand. And again, you also need that support. So when we talk about access, it's not only access to insulin, it is also about access to education, to support, and also to peers as well. So I think it's not just one topic that we have to focus on, it's the whole thing. So I guess I'm interested to hear from Elizabeth, what can we do as individuals to sort of work on changing this access issue or tackling it on, from a local or regional or even global perspective, and I guess a bit more about what T1 International is doing to work through this as well.
Definitely. I think it's a great segue in as what all of you are talking about, these sort of very sometimes specific, but a lot of overlap as well. So what we're doing at T1 International, we kind of have a 4-part strategy. So really briefly, the first thing, and this is great because you can all do these things individually as well. You can join with what we're doing at T1 International, and you can be sort of active in your own right on whatever level and whatever time commitment you want to be. Just doing something like this, for example, this roundtable, it's raising awareness about the issues. It's getting people to think about things that they might not already think of. Diabetes is a 24/7 self-managed condition for the most part, so it's not that easy sometimes to think outside of ourselves and what other people are dealing with. So that's what we try to do as our first point, is share stories, raise awareness about these issues, try to get as good of an understanding possible about what's going on around the world. We also try to connect people. Ash mentioned one of those key puzzle pieces is support, is connecting with other people living with diabetes. So we're able to connect people around the world either to each other, so individuals get together and sort of start up a support group, or they join in with an existing great initiative that's already going on in their local area. And I think that's so important, because people who are living in a place know their issues and their challenges the best, and working together, they can, come up with advocacy plans and find ways to tackle what their most critical diabetes issue is, as Pei said. So that's the second thing. And the third thing is pushing for research and data. We know that there's just a huge lack of data and research that exists in some parts of the world, particularly in parts of Africa and Southeast Asia. Hardly any prevalence data. So the numbers of people living with type 1 diabetes, for example, are almost non-existent. The most basic understanding of what it's like with the condition in that place. How can you, build solutions? So that's a huge, important piece of that, is getting that information out there. And then finally, it's the advocacy and campaigning. That's the final piece. And I think what we've all been talking about today is a great way to sort of, okay, it's overwhelming when you look at the big problems and you look at the global issues, but I think the way Rob framed it is really positive in that we find our most pressing issue locally. We also then can connect with people who are dealing with the same issue or something similar. And while everything's very different, one of the bonuses about having this global diabetes community, particularly when it comes to access, is you can share best practice and say, well, we want the government to, have them create a stipend for people to make their insulin cheaper, and we want to do this in this other country. Here's some of the stumbling blocks. Here's some take from each other, and that's just a huge way that advocacy can be so much more powerful. So we have an advocacy toolkit that we research all of you as a first step to have a look at that, decide what your one issue is that you want to tackle, and we can connect you to other people working on that same issue, so you're not alone in anything that you want to do. And yeah, get in touch with us if you have any more questions about that, because it was a very whirlwind tour of what we're doing.
Thank you so much, Elizabeth. And yeah, really hoping to get into now kind of what we can do. But before we do that, I see that we have a few questions here specific for you, and they're tough ones, so get ready. So what are your thoughts on the lawsuit against pharma in the USA that is currently a hot topic? And do you think the outcome might be and potentially affect access to insulin globally? From Stephanie.
Great questions. So I think, the more we're seeing more and more momentum of people speaking out about the crazy exorbitant high cost of insulin in the US. So to see the lawsuit coming out I think is a positive thing. It's, we're not legal experts at Human International, but it's always positive, I think, to see it's patients with diabetes. They're being represented by law. They are speaking out about, this is the damages I've suffered. This is why it's not okay for the costs to be so high. And from what I understand from the legal team, the hope is it will at least be the start of impacting access to insulin in the US, but also around the globe. The US in some ways can set precedents for the rest of the world, but I was talking about transparency earlier. I don't know that this lawsuit will, force all pharmaceutical companies to reveal their costing information and their price setting, but I think it can very much hold their feet to the fire a little bit to show that, people are looking at this. People are going to try to hold you accountable for high prices, and we're going to try to stop any of these sort of potentially illegal practices that are happening, which if it comes to that will certainly affect how pricing works in the rest of the world, I think, or it can impact it at the very least. People are going to try to hold you accountable for high prices, and we're going to try to stop any of these sort of potentially illegal practices that are happening, which if it comes to that will certainly affect how pricing works in the rest of the world, I think, or it can impact it at the very least.
Quick follow-up, and I'll see if Ashley and Payan have anything after. And then we're going to get to what we need to talk about, and that's actually how to start making change and start improving the situation at a global, at a local, and at a regional level. But my question's this, and I have a lot of friends and I have a lot of people that I know in my world that are in the pharmaceutical industry. How much is on them? And is it really their fault, or is it the variables and the inconsistencies of the market globally that's creating the challenges maybe for them? I mean, they have challenges too, right? And how much of this gets put onto them?
Not to sound like I'm just repeating myself, but I do feel that there's the argument that they're a business and they're out to make profit. And while I can understand and appreciate that, when you're making billions and your CEOs are just being paid these outlandish salaries, to me, I just feel that companies that are providing medicine, they are creating and in a way providing these things. They have some sort of responsibility. It also is a really interesting when you start to think about some of these locations around the world where there's just barely any insulin there. It opens up another market for these companies if they are selling to people who previously couldn't afford it at all because they were dying. If they're now making it at a significantly reduced price, but they're still selling it to hundreds or thousands more people. So there, I mean, it's a really complex question you ask, and I think there are a lot of differing opinions about it out there. But I think that they should be held accountable, and I think it's also important to recognize that there are other barriers, there are other things that make access and affordability a huge issue. But I personally think pharma can do a lot more, and rather than funding a lot of patient advocacy groups, which we've been hearing a lot more about in the news, not just with diabetes, but with EpiPen, for example, and different unquote patient advocacy groups that are taking a lot of funding from these companies, and thus encouraging these groups to not speak out against this issue. So it's multi-layered, and there's a lot of things to consider, but I think they can do more real things as opposed to some of these clandestine acts that they're doing at the moment.
Yeah, fair enough. I agree with what you say. And maybe it's also kind of this digitalization of the world, and everybody now using social media and being able to connect on Facebook, being able to connect on email and phone and Skype around the world. That's really shining light on the realities that are there today for accessing medication. So let's get, and I know we only have a little bit left, but I really want to make sure we focus on the topic, and that's access to medication. So how do we get to a point where everyone can access medication? Again, you said earlier that 1 in every 2 people that need insulin don't have access to it or can't access it. What are the lowest hanging fruit here? What are the barriers that are easiest for advocates, people with diabetes, to start tackling at a local, a regional, and then a global level? How do we fix this situation, Elizabeth?
That is quite a question. That's the big question, isn't it? How do we fix this? So as I kind of gave in my whirlwind tour of our 4 strategy points as an organization, that's how we see change happening. In effect, it's uniting globally to do joint group massive. We need to keep growing our numbers to do some of these more higher level campaigns, pushing for access, lower prices, more transparency. But then I think the real change in the real solid work comes from grassroots groups on their local level around the world. So again, this toolkit we think is the first step in that, because whether you've done advocacy before or whether you're excited but you don't really know where to start, the tools in this resource really help you say, okay, I want to fix access to insulin in my country. Even that's a huge, massive goal, and that's an incredible aim. Really choose something achievable, and maybe that's your local town. How do you get people to understand, and how do you get whether it's you call it representative or your mayor or whoever's kind of a local authority in your town, maybe your first goal is you want to convince them to be on board so that they can then go up into the higher level government. So it kind of sounds like many steps, but actually, if you pick something achievable that is going to support your much bigger aim, then you're going to be invigorated, and you're going to be much more likely to achieve that goal. And you're going to be able to, as I said before, share that best practice with others who are trying similar things. So it's really, I think, first and foremost, you need to hone in on what is the thing that I most want to change. And maybe it's locally, maybe it's nationally, and that's fine. But you want to be able to kind of get your core team together and figure out what that is, and come up with a plan of how to do that. And hopefully this toolkit that we have helps you do that and helps you get that action plan set out. And that would be my suggestion for want to jump in but are a bit unsure. And again, like I said, there's different levels. You don't have to have a job. We all have our lives we're trying to live, and we all, have our own barriers that keep us from doing some of these things full time. So don't feel overwhelmed. Just take it one step at a time.
Just a couple thoughts from me. I totally agree with that, and we will make sure that our viewers and our listeners have the ability to access that toolkit, which is incredible. But yeah, for me, I think, and I'd love to pass it around after, but for me, yeah, I really think that there's a lot of power and strength and value in the numbers. And again, now that we've, had this discussion, I'm learning more and more, and reading everything that's been going on our social feed and hearing from our members and viewers and friends and partners, a lot of these challenges are similar. So maybe the first place in, the global online community is really to connect with one another and share those stories and listen to others and really make sure that, you have a strong foundation, not just individually, but you can speak to this at a collective level. And so, yeah, that was great. And I just wanted to add my own perspective onto that. And I'm going to pass it over to Payan.
Yes, I've really, through this roundtable session, I really appreciate Elizabeth for joining us as a guest speaker today. And I've actually learned a lot about what access means. And from one thing that I just want to mention, which I actually made a comment in the video, is that access doesn't mean that you get access. You are able to get hold of insulin to, for people with diabetes. Access also means getting hold of diabetes technology or diabetes tools to help you manage your diabetes better. So it need not be the latest technology, but fundamentally, are we able to get the basic tools for us to manage our diabetes? Yeah, that's what I will have to say for today. And I will really thank all of you for coming. I'll pass on now to Ash.
Every time we have these roundtables, we always talk about something that's so inspiring, and having Elizabeth here has also been amazing to learn about things like, the role of generic insulin, or biosimilar insulins, I should say, and, what's actually happening in the world of access and how it encapsulates more than just access to insulin. And it was great that, we touched so upon what we can actually do. And, from an individual's perspective, is definitely about raising awareness of what diabetes is, type 1, type 2, everything in between, all of that kind of stuff, raising awareness of what living with diabetes is and why access is so important. And I think the more we speak out together in one voice, the louder we can be heard. So, it's been fantastic. Thank you so much, Elizabeth, for joining us. Thank you all for coming. And I'll pass it back on to Rob.
Awesome. Thank you, Ashley. And Elizabeth, I'm going to let you say kind of your closing remarks here, and then I'm going to close this out for this time around. So I'll pass it back to you one last time.
Great. Thanks, Rob. And thanks, everyone, for such a lively and, very important discussion. I agree. Let's keep the conversation going outside of just this. And we do need to join together. I can only reiterate really what you've all said and how you've summarized it so nicely. It's very important for us to keep speaking out, keep letting people know that this is a very pressing issue. It's a tough one to think about sometimes, but we've got to look out for our fellow people with diabetes around the world and work with them to solve these issues. And I'm confident that we can do that. We just got to keep at it. So thanks again, everyone.
Thanks to everyone that's been talking with us all week. And a big thanks to, again, Elizabeth and to International. And make sure to check out her organization or website and their advocacy toolkit. And for Beta Change, this has been another roundtable. Really, really exciting topics that we discussed today, and really excited to continue talking about these important topics after the roundtable. I hope you can all reach out. Big thanks to the Beta Change team on the call, Ashley, Pan, and most importantly, we have Katie Doyle behind the scenes, making this all run so smoothly. So Katie, thank you so much. And also to Stephanie, controlling the social media. So thank you there. We got a website coming up soon, so make sure you're looking out for betachange.com and betachange.org. We would love to hear what your stories and your thoughts are for this roundtable and for anything else going on. And join us next month. Next month, we're going to be talking about the very interesting topic of technology, which I think we all know that you have a comment or a thought on. Let's wrap it up now, and thanks again for everybody to join us. And this has been your Beta Change Virtual Roundtable.